enabled.
Yeah, I was just listening to this music. A little jazzy, 4 in the afternoon jazzy stuff. Hello, my name is Dean Mesereau. I'm here for the city. Yes, we are live. It's been a busy Monday. A busy Monday. Different than the busy Mondays of the past, but it is a busy Monday. And thank you for watching all of our updates. I know some of you have been really good at sort of tuning in at every single one or most of them. And that's good because you can get the information and share it correctly. And with so much information today, it's easy to get information that might not be exactly 100% correct. And then once it starts going viral, there's almost no stopping it. But that hasn't happened here. And yes, good afternoon, everyone. So here we are at our 4 o'clock briefing, and lots to talk about this afternoon. First of all, and I'll read you the numbers. We have the local numbers. We have masks, and I'm happy to say, a friend of mine, he didn't give me permission to use his name, but he brought 6,000 of these masks to us today. And so they are available at Emergency Management. They're going to be closing soon, but you can stop by tomorrow at 37 Carter Street, starting around 9 o'clock. But they're triple layered, right? It's like a little sort of, this section right here is, I don't know, it's got little, almost appears to be a little pinholes like mesh, but it's solid. And then it's got another layer, and then the obviously the face layer. So there's 3 layers in it. Comes with a, so just to show you, it comes with elastics that will fit over anyone's head or ears. And at the top is a metal piece, and you can just sort of form that to you. So this has been good for me today, especially. It's light duty. I have a hard time wearing these that sort of, I get claustrophobic in them a little bit, but this seems to be okay, and pull it down and I can adjust it and seal it. And when I'm around other people and it looks like I'm within 6 feet, I don't take any chances, down it goes when I'm done. So up, reseal it, and then down later when I'm not around anybody within, well, my 8 to 10 feet rule. So let's see what's happening. Let's see, did Wendy send it? Okay, here we go. I will give you the numbers, and then we'll give them a couple of times during our 4 o'clock update, if that's okay. So yesterday we were at 133 active. Today we're at 144. But the good news is we're at 115 completed and 105 yesterday. So we've gone from 133, we've gone up 10. We went up 10 from the day before. But again, the state's doing more testing than they ever have. So you're going to get more positives, and we'll talk about that in a minute. So we've actually, in terms of those that are completed, we have gone up 10, actually 15. No, 10. That's fine. 10 to, so 105 to 115, and we've gone up 10 or 11, so 133 to 144. So 10 or so, right? And so total active today, 259. Yesterday was 239. So we are going up on one end, dropping another. And clearly, with the amount of testing that the state is doing, yesterday broke a record for the amount of testing that's been done. I'll read you that right here. Yesterday did 16,000 people were tested. That's the most amount ever. And what's going to happen is the more people that you test, the more that you're going to find positives. I know that some of the nursing homes, assisted living, were done, and I believe some of those were tested positive. So we're getting to those most vulnerable. Remember, we talked about it before, people with symptoms, and then they lowered it to symptoms would get tested, symptoms with a doctor's note, and then it went to just symptoms, and now we're beginning to get to those areas of those nursing homes where it is so hard. They are working so hard to keep it from spreading or from containment completely, and assisted living in other places where it's close proximity. So what that means is that positive testing is getting positive results, and in many cases there are no symptoms, but in other cases there are. Let's see. Well, on a, just a heads up, according to my doctor, the mask should be worn with the colored side facing down. Well, on these, are you saying, so this is the front, right? Isn't this the front versus this? Because the elastic is in the back. And also, you can only wear one way because there's a little metal part in the top. So we have these to give out. Anyway, those are the numbers. I'll give you more about the numbers later on, and just tell you that we have thousands of these to give out. Does that mean there are 45, 50,000 people in Leominster? So we want you to take what you really need, and if you need to come back, that's fine, but we're trying to get one to everyone. So we've got thousands to give out, but we really want to make sure that everybody gets one. And so that's the lowdown on that. And if you, again, I sort of had Keith cut one in half, and if you cut it in half, it's 3-layered, and again, it'll help you out, right? It's what they call sort of the citizens, or the it's a version of I guess a medical mask or a surgical mask or whatever. But anyway, there's no labeling on them or anything, and they're don't cost you anything, and facing out, away from you, white against your face. Yeah, well, that's how we've been doing it, right? This one is a little bit different. I don't know. I must have picked this up in my car. I have a number of them. But, yes. So, metal, blew out, face in, foam. You can feel it. So there's almost no way you can't wear it correctly because there's a metal piece in the top. But yes, the blue piece out. Yes. There you go. So I put this aside. Get back to my original screen. And let's see. There you go. There I am with the mask on. We're a little delayed here. Okay, let's get to work. Emergency management number 978-534-7500, extension 5055. I would say you could stop down here tomorrow around 9 o'clock. They're at 37 Carter Street. If the weather's okay tomorrow, we'll set up a table out front of City Hall, and you can stop by there as well. And again, everything is, all of this information I share with you tonight is available on our Facebook page and website, along with, well, if you don't find it, then all kinds of forms, and you could pay online, but if for some reason it isn't available, then obviously call our office at 978-534-7500, extension 0, and we'll help you out with anything. Having a hard time filling out a form, applying for those unemployment benefits, maneuvering around your computer, we can even set up Skype, whatever it takes. We want to get you to the finish line. There's the number for unemployment benefits, mass.gov/DUA. For those self-employed contractor unemployment benefits, mass.gov/PUA. Paycheck Protection Program, go to the SBA website, fill it out. I've heard some people getting accepted, a few that were not approved. But anyway, go ahead and apply. There's the Family Health Line for nursing home patients. If you're having an issue, questions, concerns, 617-660-5396, and the Sexual Assault and Domestic Violence Hotline, 877-785-2020. Where and when can you pick them up? I don't know. I'd go to emergency management around 9 tomorrow morning. They're at 37 Carter Street, C-A-R-T-E-R Street in Leominster. They're where what do you call it used to be? Try some potato chip. Let me go back one. I guess these guys jumped to it. You guys are quick. To apply for, oh yeah, we did that one. Okay. Just want to make sure we're lined up. 4 business questions are, and we're really trying to get businesses to think about what it's going to look like when you open. I was asked a number of times today, and I said this 2 or 3 weeks ago. The pressure is going to be mounting. The numbers will stabilize, and the governor said today Worcester's not great, and Boston and that area seems to have quieted, and North Worcester County we're finding more test positives, but we don't see the huge increase in hospitalization, and so he's still having that sort of issue in a few parts of the state. Hopefully, this is the week where it sort of generalizes or at least levels off across the state. And let's hope for that. And so the question is, when do you think things will open? Well, I think I can just feel the pressure that the governor's under, the lieutenant governor, and I can see they're beginning to talk about the opening. And I would suggest you get your business ready. And I think they'll just start releasing, even before the 18th, I think they'll start sort of releasing some guidelines for businesses. And so get ready for it, right? So limited amount of people that come into your business, keeping people socially distanced who work there, keeping plenty of hand sanitizer around, keep masks around for those visiting or those that might have forgot their mask, so you want to give them one. Mask, remember, are for a couple of things. Our CDC says the mask are so that you don't give it to somebody else. And remember, if you don't know you don't have it, it's quite possible that you could be giving it to someone else, so wear that mask. The other part of it is, I see people walking down the street with a mask on. I see people driving with a mask on. And I see people riding a bike with a mask on. Well, that's, listen, if you want to ride, walk, run, whatever it is with your mask, you're welcome to do so, but not necessary because you're keeping your social distance. Remember, the governor said if you cannot keep your social distance, mask. If you're going to a grocery store, any of those kinds of businesses, then mask up. So that's what life's going to look a lot like for small business and medium and large businesses. It's going to look a lot different. So start spacing people and things out. I would start off with limited hours. That's what I would do. And even if I was a hairstylist and I had 20 or 30 people that wanted to pay me 3 times what it was worth for my haircut, I would limit it and take so many a day and inch your way into it. Baby steps. You don't want anybody feeling uneasy about it. You just want to kind of baby step your way in. And plenty of hand sanitizer, some mask around. I would just thin things out in general. I'd get rid of any kind of a waiting room. I would somehow or another get people's phone number and call them when they're next up. Give them a cup of coffee. Give them a puzzle to do, word puzzle. Give them some things. Give them the newspaper. Have them read it. Give them a magazine. Let them sit in the parking lot. That's how I would do it. If it's possible in your business, you can make appointments. That's even better. Not all businesses are like that. I know in my business how we plan to sort of just gradually, but it's baby steps, starting off a few days a week and then a few hours, and then we'll just keep increasing that as we go along. Plenty of we have a restroom that we let our customers use. Plenty, very clean restroom. Make sure we have plenty of hand sanitizer and soap, masks, etc. And again, limiting the amount of people that come into the store at one time. So that's what you should be thinking about. But yes, I think the answer is get ready, because the pressure's on and they're going to start opening some businesses. I'm not sure which and when, but I suspect some of them will open before the 18th, and then after that, it will be extra baby steps. I mean, I think the last thing the governor's going to want to see, or anybody's going to want to see, is this sort of boomerang effect where we just sort of get pressured into opening everything up. We open it all up, and then our numbers go up. That's not what we want to see. Give blood, 1-800-RED-CROSS. Go to my next slide. Resource for kids, leominsterlibrary.org. Free Wi-Fi out back at Leominster, LEO-LIB. Guest, no password needed. Community resources, United Way every day. You can access them by going to United Way at 211. If you need help, ask for that. If not, you go to uwncm.org, and that hooks you up at the North Central United Way. Growing Places, Wednesdays, we'll give you a little more info on that, but they go to 2 different locations and sell fresh fruits and vegetables. One is the Senior Center, and that's on Wednesdays at 11. And also on Mechanic and Laurel Street from 3:30 to 4:30. Catholic Charities, Mondays, Tuesdays, Thursdays, and Fridays, 8:30 to 4:30. Ginny's, Tuesdays through Saturdays, 10 to 1. They have a partnership with our local emergency management agency, and they're helping to deliver food and just helping up in general. So, good program. As we said, total cases in Massachusetts since day one. Tested, 68,087. We're going to give you the updated numbers right now. Here we go. Total cases in Massachusetts are now at 69,000. That's up 1,000 from yesterday. In Worcester County, we're at 6,471. That's up 183. Total tested, gone up about 10,000 to 342,000 people. Deaths in the state of Massachusetts, thank goodness, one is too many, is actually gone down to 86. I'm sorry, up 86, but that's down from 159, 154. Yesterday, deaths were at 158. So one death is too many. We'd like to have seen them all saved, but at least this is some good news in general. And yeah, that's good news there. So more people being tested, which means we're identifying those who more than likely, because the hospitalization rate is dropping, and the percentage of those getting tested is only at 17%. So out of everybody being tested, 17% of those people have symptoms. Or is it the other way around? Let me just check. Yes. So 12% of those tested are now being tested positive. That's down from 30% and 17% from last week. So 12% of those that are tested, of all those that are being tested, so if they tested that 1,000 people, then 170 of them? No, 120 tested positive. And out of that, we don't know how many had symptoms, and we don't know if they were hospitalized, but those are all pieces of information that we will have to continue to watch. Maybe this is the week 8. Maybe that is the case. Maybe this is the week where things flatten out. Massachusetts has joined the Northeast Consortium to purchase PPE and other equipment with New York, Pennsylvania, New Jersey, Delaware, Massachusetts, Connecticut, and Rhode Island. So there they all are right there. I know I kind of jumped around a little bit, but there's the second item right here where I show that the rate, 12% of all those tested are now testing positive. That's down from 30% early April and 17% from last week. So on Wednesday, that is when the governor has made the requirement that everybody wear a mask. What that means in simplicity here is, yes, you wear a mask, but you don't if you're not near other people. You can if you want, but if you're running down the street or you're walking, you're with other people in your family or whatever. But mask goes back on when you get within 6 feet. It also goes on when you're at grocery stores. That's mandatory. Grocery stores, supermarkets, anything that's still open, it's mandatory that you wear that mask. And again, within 6 feet if anyone invading your space. Let's see, 400 businesses are working with the state on making COVID-related items rather than what they were doing before. So they're making items that are helping here. And we have a number of companies in Leominster that are also part of that. This is our little graph. This is for the last 6 weeks. Shows right up to May 3rd. So we get that beginning right here at the beginning of, at the end of May. It kind of levels off there to the left. You see it's not that big of a deal. And then all of a sudden in March, the end of March, we go up and then down. We had some other ups and downs. And now we're gone up, but we're heading back down. You see that big drop there in the last couple of days from May 1st, 2nd, and 3rd. This is as of yesterday. So again, you can see this is the daily and cumulative confirmed cases. How did we do? There you go. You see some flattening across the state. Obviously, this is the new cases by date. More testing, right? More testing. You see that little spike go up there to 70,000. More testing is going to give us more results. But if you can see, it's cases confirmed. It's really leveling off overall. See it? It goes up a little and then back down. So, you know, this may be the week where things sort of turn the other way. Number of tests performed by date. Again, there you go. It's you know, it hasn't drastically gone up other than the April 23rd, and then from there on it sort of stabilizes, and then May 1st, and then obviously May 3rd, substantial increase in testing. Cases by county. So here we go. The map has changed just a little bit, but if you look by prevalence by county, and this is per 100,000 cases, you can see that it's still that Middlesex County and Essex and Plymouth. Suffolk has actually improved, but there's a piece of it there in the dark colored. Then you get to the light colored where Worcester County is, and Bristol and Hampden, and again, it's a little higher, and then you get to that western part of the state, it drops down significantly. There's the hospitalization rate. Again, to the right is per 100,000. And again, there's the number hospitalized. So you can see now we're beginning to get into some of these, you know, we're on the increase, and now we're getting to the negative numbers per 100,000. So we're at 3,617 currently hospitalized in the state of Massachusetts. There you go. Daily and cumulative deaths are over 4,000 now. Look how it's just the end, just the 1st of April. April has been just horrible. I mean, just look. It starts off and we get that sort of step, and then another step, and another step, and then we just get hit all the way across the board, all the way until finally the other day on the 27th or 28th, we start to drop down, went a little back, it went up a little, and then it's dropped down ever since. Case rate by age group. Average age still 53. This is as of yesterday. Cases right across the board over there on the left-hand side. Take a look at them, right? Even though 0 to 19. And then you look to the right-hand side for cases per 100,000, and it really jumps up when you hit that 80 plus. Let's take a look at it a different way for hospitalization rates. By age group, 69 is the average age. Again, each step on the left, but look on the right per 100,000 people, and that's how they really measure it. And as soon as you hit that 70 mark at 202, whatever that is, I can't quite see it perfectly, 292. And then from there, it just jumps up to on the 80 plus years old for an average of 79. Deaths and deaths by age group. Clearly that 80 plus, all you had to do was open that Boston Globe yesterday and look at that section of deaths, and it was clearly everyone in this age group right there. What a tough thing those families have had to go through. And our condolences to every single one of them. I mean, you don't have to know any of these people to know what they've been through, and not being able to visit, and you know, contracting the virus and having it, you know, maybe other conditions and pre-existing conditions. Anyway, we'll go to the next slide. And that had to have been a tough thing for those families. Deaths and deaths rate by county. Again, there you go. We do okay, right? There we are, Worcester County, all the way to the far right. And only Hampden County and Nantucket would be less than we are. Deaths by sex, male, female, even pretty across the board, even as of yesterday. Deaths with previous hospitalization, 57%, that's hovering where it was before. And then those with underlying conditions, 98%, which is pretty substantial. There you are, cases, hospitalization by deaths by race, ethnicity, and that hasn't changed much, but it does show a trend of those, when tracked by race and ethnicity, does have a higher rate of deaths. There we are for actual facilities in the state, long-term care in the middle at 322. Deaths reported in long-term caring facilities, now that exceeds 50%. So it's actually around 56% of all those who passed away in some sort of a long-term care facility. Supplies, obviously more and more supplies coming in as we speak, and much needed supplies. Back here is the capacity by region, and again, total of 17,900. Now that's a bit of a drop because there are more in certain areas of the state in the hospital as we speak. So it did drop a little bit. We were at 18 something for total beds. But the percentages here don't look like they've changed very much. And there's the equipment that's coming in here to the state of Massachusetts, to Worcester County, to this area. I'll give you the numbers in a minute. Again, if you're just joining us. Testing sites at RELIANT, if you are a member of RELIANT's healthcare system, call them. They will sort of get somebody on the phone with you, ask you a series of questions, and then send you for testing. Over at Health Alliance, it is 8 to 4 o'clock on Monday to Fridays, and you do have to have some symptoms before you go there. But anyway, it's 8 to 4 on Monday to Friday, and then 10 to 2 on the weekends. They're doing, I don't know, was it about 60, 65 cases averaging per day. If you have any questions, please post them here, and we'll read them off. So, I mean, many times when you think you're asking an original question, it's not so original. It's just nobody's asked the question. You asked the question, everybody's like, oh, I'm glad they answered that. I'm glad they asked the question, and I'm glad they answered the question. So here's some things. The transfer stations close on Saturday. Starburst postponed to April 22nd. We've also postponed indefinitely, but not 100% for sure, August 22nd. And graduation will be August 1st. So some folks called Comcast, and I guess they said you needed to be off Comcast for 3 months. So the way it works is if you don't currently have internet service from Comcast, but you qualify, and there are some areas of needed for qualifications. If you qualify, then you get 2 months free, and I don't know how many, but it's substantial in this area have gotten 2 months for free. and then it's $9.95 a month after that. So this has been extended. They've extended it from May 30th to end of June. And here's the phone number you call. I'm going to leave that right there if you want to take a quick picture of it. But this is also on our website. But this is the fastest way. Get your phone. I'm going to give you a minute to get your phone. Get your phone, take a picture of this, share it. It's called Comcast Essentials Program. They ask you very few questions. They qualify you, and then off you go. So it's you give them a card number, or an account number, or an item number, and they take it from there. Ah, that water tasted good. So there's that phone number. I did want to leave that up for you. Grocery guidance. We are going to have to look at some of the stores. Some of the big box retailers over the weekend. It seems like grocery stores did okay, but some of the others didn't do so great. And so we're going to have to put some, we're going to have to kind of, put some more restrictions and limit the amount of people that are in the stores. Did anybody go to Lowe's or, my phone just died, so I'm not going to be able to read your messages, but you can post them anyway. I'll look at them later. But Lowe's or Home Depot, and where the store is busy at any particular time, they are limited as to how many people they can are allowed in. And so what was conveyed to me all weekend was the amount of people that were in the stores and in line. Stimulus checks, they are coming. If not, I would go to the I would go Google IRS stimulus check. I did not receive. Other than that, it looks like pretty much everyone has been getting it. Let's see. We're going to have Memorial Day. No matter what, we're going to have it, even if it's just one person from each branch of the military and myself and the veterans agent, which makes up close to 9. But we'll wait and see what the weather's going to be. We'll wait and see what the restrictions are going to be. But either way, we will be revisiting, as we do every single year. Every single veteran will be honored with a flag, and we will also visit every single veteran in Leominster at their particular cemetery. But see these little markers here? When you get out there to start planting, I noticed some people were out yesterday. It's getting nice. And if you can clean up around some of these headstones, these are those flat markers. They're for all veterans. And there are times when family can't keep up to it. And so if you're there and you've got some tools and you want to kind of trim around it, it would be appreciated. So we'll give you the details tomorrow. But it's First Responders Day and Essential Workers Day, and that is May 7th. If you'd like to participate, we'll be doing a roving sort of run around the city with our police and fire and those that would like to participate. So it is May 7th. We're trying to get all the church bells to ring at 2 in the afternoon. Oh, boy, we got some large photos of large leaf pickups. Pickup ends the 30th, yard and waste. And if you have an opportunity, please put them at the curb, rake them, put them in a bag, put them at the curb, take a picture, send it to leominster-ma.gov, or best to send it to me directly at dmazzarella@leominster-ma.gov. And whoever wins, who has the most amount of leaves picked up and packed at the curb, wins a number of prizes. Look at that. What a guy. And I had full charge when I got here. It's time for a new phone, I guess. Can I see the remarks on this?
Should be able to.
Do I have to hit something? No, I just must have to hit something, right? There you go. That's true, huh? Louis Charpentier. Should medically fragile kids be tested even though they have no signs? I certainly would take that up with my physician. I definitely would. Home Depot has to go onto a person with a clocker. Yes, they count. But apparently they told us today that they don't have to comply with the 40% of the store makeup. It's a decision by the headquarters or something. I don't know what that was all about. I don't. Large businesses. Ooh. It's going to look a lot different. I hit volume. So start spacing people and things out. I'm not sure how he hit it. Is the number for unemployment. Yikes, I'm in trouble. Masks. There we go. Etc. And again, limiting the amount of people that come into the store at one time. Just watching myself on here. You should be thinking. I hit something. I'm trying to get it to Stand up.
Get ready, because the pressure's on, and they're going to start opening some businesses.
So you got till the 30th to get your leaves picked up, put at the corner, take a picture, send them to dmazarel@leominster-ma.gov. Flushing. Hydrants today and tomorrow, Helena Street, Main Street towards North Street, Prospect Street, and Nashua Streets area, Pear Street, and Joslyn Street. Leominster sidewalk sale, put it on your calendar. Leominster, old-fashioned bargain day sidewalk sale, June 26th, June 27th. Businesses from around the city, anywhere in the city, as long as you're a local Leominster business, can participate. Let us know if you're interested in participating. You can call Melissa Tasker or email her at mtasker@leominster-ma.gov. Somebody called today about the registry of motor vehicles. If you really need to go, call 857-368. Did I mess up your...
There you go. I'm looking for a stand.
Oh, that's all right. I'll just lay it flat. It's okay. My fault. If you're looking for an answer to the question, go to the website first. If not, 857-368-8000. And I would say only if you need a commercial license or you need to register a new vehicle should you bother going. Okay. Any words when the bottle cans return opening? I don't. They have not said a word about that. And yes, 37 Carter, C-A-R-T-E-R Street, in order to get your free mask. And again, if you need 5, you take 5, but don't take 5 and you only need 2 because you need some backups. I've got to get these in the hands of many people as we possibly can. So please just help us out there. It would really be helpful if you could just take what you need. And if you need it for a neighbor or somebody from upstairs, or you have a small business, you need it, that's fine. Just, I don't want to see these things up for sale on eBay or Marketplace or Craigslist or anything, right? These are for here. These are for us. And the donor wanted to make sure he's trying to get one to everybody in the city. How nice is that? How nice is that? I have great friends, right? Great resources and connections that you make while you're in this office. So thank you to them. So registry, they're giving sort of allowances on if your inspection stickers expired and all of that. If you didn't file your tax, you got SSI, SSD, TDA, you have to go online to IRS government website and fill out the information. Okay, so that's helpful. Thank you. Meals for first responders right up until 5/5, which is tomorrow. So you just go there and yell into the little box there and say, I'm here for the thank you meal, and they'll give you a meal, breakfast or lunch. Online participating stores, these are all companies. You can find it all on our website. These are companies who are still in business and operating and doing so virtually or curbside pickup, whatever it might be. I need a stethoscope very badly because when I kick into this Dr. Mazzarella thing, I just don't feel that. I've got my mask now, so I need that stethoscope. But it's time for Dr. Mazzarella's boot camp. Assume you have the virus. Assume everyone you come in contact with has the virus. Stay away, stay away, stay away. They say 6 feet, I say 10 feet. Wear your mask if you're going to be around anybody, less than 6 feet. If you're going to the grocery store or any other building, you're going to have to wear a mask either way. Make sure you fit it correctly around your nose and seal it. Wash your hands, wash your hands, wash your hands. And also, how do you go about getting your jog license? I didn't mention that, did it? So if you already have your rabies shots, then you can just call the clerk's office, and the renewals have been extended to June 1st, but you can still call the clerk's office, and I think you can fax or email them a copy of your, I think what they need, as long as your dog was already in the system, they just need a copy of your rabies report. So I hope I answered that question. So wash your hands and then sanitizer. We are getting a shipment of bottles tomorrow. We're going to start bottling our own hand sanitizer. We'll share that with you as well. There'll be no cost. There's no cost for these masks. These were donated. We have 2 barrels of sanitizer. We want to make sure we get them into the hands, very pun intended. And we want to get everybody healthy, right? We want to keep you healthy. So let me take off my stethoscope. There you go. Also have a page dedicated to all those. Now, we are going to do something. We're not sure exactly what it will be, but it will be something. Thanking everybody that helped us out, no matter how small. There was a person that sent something in today. is a $20 gift card to Market Basket, and they said, you know what, if you run into somebody that really needs some food, give them the gift card. No address, no return address, no name, just an act of kindness. So thank you to everybody, but we will make sure everyone gets thanked in the proper way. Senior shopping hours, everybody has them. Just call or go to their website to check what their hours are. Let's get to the food part. There you go. There are so many restaurants and so many choices. They appreciate it. I'm shared this every day. Please thank everyone that watches. Thank them, thank them, thank them, because it's helping us stay alive and get to the other end. Every day we're on the phone with restaurants about how they can, when we open, what's that going to look like? So if you remember, I'm not trying to give myself too much credit here, but if you remember, every week I sort of give you a little insight as to what's coming the following week or the following week. So a couple of weeks ago I said, imagine those people that have to get on a train. Imagine those people that have to get on a crowded subway. Imagine those people that have to walk into those crowded lobbies in those big office buildings in metropolitan Boston. And lo and behold, the headline today, the thrill of city living might be gone. And this is a Globe article, and it talks all about how it used to be the in thing and how fashionable it was, and people didn't have money to keep a car. It was very expensive, so that's okay because they were paying high rent, but they didn't need a car because they used public transportation, and how all that is going to change. And I suggested to you in the past, more and more people are going to want to come west. We have lots to offer. Businesses will begin to realize this, and this all actually started even before with the fact that you can't get in and out of the city. So not that it's worse for them, better for us, but what I'm trying to do is lay out each time we meet and each week, trying to give you a little bit of a foresight in terms of what I think might be happening. This morning, if you didn't join us, and we have about, I don't know, 50 or so joining us here on the the Facebook page for Leominster TV, but also a number of people that are watching. So there are probably several hundred people total watching. But as I described this morning, if I could put them into little silos, this was my weekend from Friday on. It was those who are unemployed, those that are employed, work in essential services, many working for minimum wage or close to it. Their friends are not working, making more unemployed, having fun, apparently, and enjoying life and sleeping late. That was one silo of people that sort of I interacted with. The other silo is, I've seen the devastation of this illness. You've got to commit to stay in, follow all the CDC regulations, don't open anything. Leave it all locked down, don't open it. And then the third column, which is businesses who say, yes, I realize this illness is serious. I realize that, it's been 8 weeks. I don't know how much longer I can go. I've used up almost everything that I had to put towards this, and I'm not sure I can reopen if we don't get going soon. So those were the three silos driving most of discussions this past weekend, and I'm sure you're going to hear more of it. Yes, week 8 and week 9, you are really going to hear it. All one needs to do, you could hear it just a couple of weeks ago when the tone started to change for the governor at his press conferences, started to get to when are things going to open. Remember, this has hit the elderly really hard, really hard. How did they get it? More than likely, they weren't out to get it. This was brought to them. That's as simple as I can explain it. They weren't out. They were not following social distances. They probably had a pre-existing condition. They were probably trying to be as careful as they were. Wherever they were, whether it be a nursing home or assisted living, they were probably trying to do the best that they could and keep people separated, stopping visitors from coming in. But somehow or another, this was more than likely, and again, we'll have to wait for the final data to be in, but this was more than likely brought to them. So that is where that overwhelming amounts of caution, the overabundance of caution comes into place, because Young people, as you see, get it, survive, all the way up to the near 50s, get it, survive, and then we hit that age group, and it is not so receptive to them. They struggle, especially if they have another condition, a pre-existing condition of some sort. So that is why there is such caution here, and I suggest to you they will start opening things. Weather will force that. I mean, I think you saw yesterday you couldn't go anywhere. There were people everywhere, walking, running, bikes, doing something, and getting out, right? It's the good weather. So the pressure is on them. The numbers look like they're increasing, but if you had somebody that passed away from this, that's not the numbers you're looking at, but the numbers do look a little better. They look better here. We are identifying those more than likely. Only 12%, only 12%, that's a good number. The only reason they were probably taking the test is they were near somebody or came in contact with somebody that did test positive. And even when they tested positive, we're not sure they had symptoms, so they might not have known. So this secret virus killer is even more secretive than one could thought, because if you have a cold, you know you have a cold. If you have pneumonia, you got other things going on, and you know something's wrong, and that's what brings you to the doctor, because you say, you know what, I'm feeling really horrible, and I've had this cold, and it's gone on for weeks and weeks. And generally, but this is not the case. This is the virus. Imagine a virus you could be carrying with you, and you don't know you have. That's incredible. So that's the side of caution, and that's where we really want to be sure we're making the right decisions, whether it's the state or local government or federal. So baby steps, take your time to get your business ready. For those, I understand, for those that are employed and they're making more money than those employed, that's not something I can fix, and I'm passing it off to somebody else. That's certainly an issue. So I recognize everyone who was frustrated this weekend, who let their frustration out on me. I didn't take it personal. I get it. I understand. The money was put out there to keep things stable, to keep people receiving checks so they can continue to pay their bills. It's a lot harder to get the economy going after than it is to let it all fall apart, i.e. the last recession depression that we had in 2008, when we saw what happened where the FDIC said, that's it. If you don't have a proper debt per ratio, and your debt per ratio was out of whack, even though we know in the next year or two you'll make that money back, put you back into proper balance, we're taking over the bank and we're shutting you down. You know how many banks across the United States were shut down, even when they knew in a year or two that they would rebound and be back in good fiscal condition? No, that's what it said. That was it. The banks were in trouble. The banks aren't in trouble this time. They realized a whole lot of things, that it took us 10 years to come out of a recession. No, longer to come out of the recession, because the recession lasted for about 10 years. We've only been out of it a short amount of time. And the time that we've been out, it's been a struggle and those that survive continue to struggle in a lot of cases. So what does all that mean? And I'm going to hit the refresh button here. I'm probably going to get in trouble. I don't know where it is. It's okay. No. Anyway, that's okay. But so the government is trying to keep things going so that they don't just shut down completely. It's a lot more expensive to get it going the other way. I get that. But all things, even the money that was pumped out to small businesses, didn't always end up in the places that it was supposed to. So it's confusing at sometimes and frustrating, and I get it. For those businesses, believe me, I get it. We've been shut down for 8 weeks. We get it. And but in the meantime, we're working and planning and seeing what we're going to look like when we open again, and doing everything we can to stay alive, and selling some things, on Marketplace or Craigslist, trying to generate enough money to keep the place alive. So those are the three silos driving time this weekend, and also, unfortunately, a number of friends who lost some loved ones who they took care of better than one can imagine. And it's a tough thing not to be able to be with them in their final moments, and a difficult thing, very difficult. So for them, our condolences. I won't say their names. I didn't see it in obituaries today, so I will not. But I think you know who I'm talking about. A number of people whose parents tested positive. Some of the nursing homes and assisted livings did across the board testing this weekend, so they did find some positives. And it looks like people are okay. I'm just going to cross my fingers on that one, okay, as we speak. And so a lot going on here still. and some promise in those numbers, but we're going to continue to get increases in those testing positive. We at City Hall today are at full staff. So this morning we temperature test everybody to make sure they're they're running a temperature. We have masks. So those kinds of preventative things will help. But we're going to test more. We're going to get more that test positive. But out of that, as you can see, only the good part is 12% have symptoms. And no, out of all of those, wow, look at that. That's cool. I just got some sort of a message about social distancing. How cool. So out of that, I think I said 12% out of all those tested were testing positive. And I suggest to you, out of that 12%, most of that percentage were people that didn't know they have it. That's a dual, right? That's a good thing and a bad thing. The bad thing is they were probably out in the community spreading it or possibly spreading it. The good thing is those numbers are going down in terms of testing positive. So those are all good things. So let me just make sure I didn't forget anything really important. It's been a busy day. Thank you for your patience. Don't forget, parks are open, but you can't use the playground equipment and all those. Common sense, right? 28 miles, 26 miles of trails and parks. Go to our website, leominster-ma.gov. Visit the recreation department, and they'll tell you everything you need to know. Don't forget, our friend Sonny, WLPZ 95.1. After this is done, if you didn't catch it on Facebook or watch it on TV and you're outside, you're doing something, just pump it up on WLPZ.org. Click on it. They'll get a chance to replay it. So there you go. And there we are back here. And I'll do the numbers one more time for you if you'd like. Let's see. Let me, oh no, I can't do because my phone died and that's where they were. Let's see. I'll post them for you when I leave here. Anyway, they were up by 10 today. That's positive. And also down by 10 on those that are completed their quarantine and are 7 days without symptoms. And again, they are instructed to wear masks, gloves, sanitizer, all of that before they enter back into the workforce, et cetera. So I think we've covered everything for today. Thank you, Keith and Bradley. Mask one more time. I know people are in and out in terms of when they visit us. Mask after 9 o'clock tomorrow, 37 Carter Street, C-A-R-T-E-R Street. I think we're going to set up a table out front of City Hall tomorrow as well. So 37 Carter Street after 9 o'clock, and take what you need. If you don't need them, don't take 10 if you need 2. Take 2 if you need 2. If you need them for a neighbor, you need them for someone else. You live in an apartment complex, you want to take some extras, that's fine. We want to make sure we're trying to get 1 to everybody to get started. So there we are. Thank you for watching. Take care of yourself. Be kind. Be generous. Be patient. We're in week 8, right? This is a week of new beginnings. This is the week that things are going to turn around. Okay, we'll talk to you later. Thank you to all those essential workers, first responders, those in the medical world, from A to Z, no matter what part you play part of the team, and it's the team that makes it happen. All right, good night. Hey, look at that. I didn't see that. Look at that. I'm sorry, I almost missed that. So, a big congratulations, right, to Leominster High School, Leominster native, Leominster High School graduate, also quarterback, right, for the 1998 Super Bowl winning. And there's Jonathan Quinn, promoted to sergeant. You know I would have been there, Jonathan. First class E7 this past Friday at his Camp Humphrey in South Korea, and May 1st. So again, a big congratulations to the Quinn family. Believe me, if I could have been there, you know I would have flown to South Korea to see this. I'm awful proud of him, and so are we. And Leominster High School, Leominster native, Leominster High School graduate, and also the 1998 Super Bowl winning quarterback. And there we are. Hey, look at this. Tara and I were out yesterday, and along with Richard Voltor, and I got to tell you, this was a moving ceremony, I'm sure, to the parents. But so typically what would happen is they would have had a much larger ceremony with many more people it would have been more ceremonial and more speeches, which, you know, could go either way. But because of what's happening with COVID-19, that wasn't possible. So these are local folks. So it was decided to go to the Old North Bridge in Concord at 4 yesterday afternoon, Sunday. And we would witness their historic moment at for me, if I was anyone getting promoted or sworn into anything, anywhere, this is where it would be. And it was a very moving ceremony. And so we got to see Brennan and others reach the rank of lieutenant, second lieutenant. And again, congratulations to him. If there's anybody out there who we can congratulate for you, Babe Ruth said if it's bragging and you could do it, no. If you can do it and it's true, it's not bragging. So it's okay for parents to brag. It's not okay for me to brag. It's okay for you. And loved ones, send us this information. Let us know about these things. And we'll be glad to post these things, right? Congratulations. And Friday night, I had a ball. I shouldn't get paid for this job. I was, usually on Friday nights, it's a night of gathering at the Beacon of Hope. And while we couldn't get together, we got together on Zoom, and we had a blast. I think it was over an hour, and we chatted, and I blew the horn, and I sang, and I played some music. So if somebody said something about a song, I pumped it up on YouTube, and we laughed, and we had fun. Everyone exchanged stories about what was going on. So, you know, this year they can't do the walk for the Beacon of Hope, and that is a big fundraiser for them. So if you find it in your budget to send something off to the Beacon of Hope, it would be appreciated. Also, there will not be a Apple Blossom Festival at Shoalin, but I'll let you know when Shoalin is active in terms of the Apple Blossom. And again, we'll invite you out. But again, if you can make a donation, this is a difficult time for them. This is when they raise a lot of the money that carries them through till apple season. Hey, we're out of time because we're going to replay this show. Thank you. And thank you for watching. We'll see you tomorrow morning somewhere at 9 o'clock. Good night.